And with MCAT and so many other variables, they go through this interview process and get into med school, which is 4 year again. And then after med school, they also go through USMLE. So they give this test USMLE, which essentially licenses them to practice in this country. That's where we come in. So because we did our med school in India or outside US, we are addressed as international medical graduates here. So the whole process of international medical graduate start from USMLE. Okay, so the residency programs here, there are surgical and non-surgical specialties, just like in India. It's kind of similar to India. Some specialties are different. The non-surgical specialties are internal medicine. Internal medicine is again primary care, primary internal medicine, and categorical medicine. I did the categorical version, which is more inpatient. Primary internal medicine is more primary care focused. Then, so I have written all those numbers against all those specialties. Those are the years, the duration of residency here. So internal medicine is 3 years. Then family practice. Family practice, essentially you rotate in every specialty. So you go through OBGYN, surgery, pediatrics, everything, just like our house agency. It's 3 years of that. And that's family practice. And after family practice, you can go to sports medicine, different specialties, or you can practice as a primary care physician. Then pediatrics, again, 3 years. Then there is this MedPeds, which is a combination of medicine and pediatrics. It's 2 year medicine, 2 year pediatrics. The neurology is total 4 years. The one that have the 1 + 3, the one is the preliminary medicine that you have to do before doing neurology. Then pathology is 4 years. And our forensic medicine comes as a fellowship of pathology. Then emergency medicine, again, 3 to 4 years, preventive medicine, then dermatology and psychiatry. These are the non-surgical specialties. And then there is this physical medicine, rehab, etc. There are some other specialties too there. The reason why I talked about non-surgical specialties first is these are the specialties that IMGs can easily match into. So the surgical specialties, the graduates from here like surgical specialties more, most likely because they are procedural, and procedures, you make more money with procedures. So probably that's the reason why it's very competitive here. So the first question that you have to ask before you start thinking about USMLE is what specialty you really like, whether it's a surgical or a non-surgical specialty. For example, if you really want to go into surgical specialty, you want to be a cardiothoracic surgeon or vascular surgeon, you have to, I would say, think twice before you start writing or preparing USMLE, because it's very competitive here. It is doable, but then it's going to be very difficult. Again, the surgical specialties, the one thing about non-surgical specialty, you might have noticed that neurology is a residency. It's not a subspecialty. In India, it's a subspecialty of general medicine. Here, neurology is different. So if you are really into neurology, actually, it's a good thing for you. You can directly get into neurology here. So again, coming back to surgical specialties, general surgery is 5 years. Urology, again, it's a residency, 5 years. Neurosurgery is a direct 7-year residency program. Vascular surgery, 5. Cardiothoracic is 6. Interventional radiology, again, you have to do 1 year of transitional medicine, rotate in all specialties, and then 4 years of radiology. Orthopedic surgery, 5. Plastic surgery, 6. OBGYN, 4. ENT, 5. And ophthalmologist, 1 preliminary medicine and 3 years of ophthalmology. So these are essentially the residency programs. There are some others too that I haven't mentioned, but the main residency programs are these. And for IMGs or international medical graduates, I would say focus more on non-surgical specialties. Okay. So, and these residencies, so there were so many questions about cost, whether you get scholarship for residency, etc. So good thing about residency is once you get residency, they pay you. So there is a stipend of $55,000 to $65,000 based on which specialty you are in. That's pretty much, that's very good amount. You can, for a couple to live here, I would say that's a good amount. So don't worry about cost once you get into residency. The whole thing is about how to get into residency. Okay, so residency, let me give you a brief talk about the residency application process. So the first and foremost, your medical school should be registered in World Directory of Med Schools. So that's very important. And most of the Indian med schools are there. And I can completely assure you Government Medical College of Thrissur is there. So don't worry about that part. But that's one thing you have to always check before you start the process. And one term you should familiarize yourself so well is ECFMG. So ECFMG is the Educational Commission for Foreign Medical Graduates. So this is the ECFMG website is something, the go-to website for all of you. So first step, go to ECFMG website and read about the ECFMG booklet is very helpful. They keep it updated and things do change too. So what is ECFMG? It's an organization that essentially verifies your records and credential you so that you can apply into these residency programs here. So because US gets so many applications from outside countries, ECFMG essentially makes sure that the outside medical education program or whichever med school you guys are from, their curriculum and things fit with US medical education. And they will verify your records. So they will make sure they will be in contact with your med school. They verify your certificates and all the process, the application, the USMLE application, everything goes through ECFMG. So that's the go-to website for IMGs. So the first step in USMLE or in the whole process is to register. So go to the ECFMG website and register. And then you will get an ECFMG or USMLE identification number, and that number is with which you do everything else. So first step, register an ECFMG, then also start the process of ECFMG certification. So apply for ECFMG certification. That doesn't mean that you're going to get the certification right away. You start the process. In order to get the ECFMG certification, you have to do your USMLE step 1, step 2 CK, as well as now there is that OET. So once you register in ECFMG, you apply for your USMLE step 1 through it. Through the website, you can apply USMLE step 1. And USMLE step 1, because you guys asked about the cost, I have noted the cost against each of them. So ECFMG certification application comes to $160. Then USMLE step 1 is $1,000 plus. So if you're taking the exam from India, there is an extra of $195. So the USMLE step 1, once you register, there'll be these prometric centers that you can opt for. So you take this exam at a prometric center, and there are different prometric centers in India. So when I took my exam, I went to Chennai Chennai Prometric Center to give my exam. So you will be able to see which one is nearest to you. So step 1, again, I'll go into details about the whole exam later. So apply for step 1. Usually the preparation take, I would say, 6 to 8 weeks, or I would say 3 months for us. So step 1 includes non-clinical subjects. So step 1 is essentially med school 1 and 2 of US. So that's non-clinical only. And comparing to all of the steps, I would say step 1 is the toughest. And so many people had so much trouble getting good scores in step 1 that really affected their application process. I'll talk about step 1 and stuff more later. Then next, apply for step 2 CK, give the exam, and then, so this is all through ECFMG website, the USMLE application. Ever since COVID, there is a change. So there used to be step 2 CS, which is clinical skills assessment. So for that, you guys have to come to US and give the exam here because it's direct patient interaction. You will have fake patients and you take history and physicals from the patient and come to a differential diagnosis or diagnosis. And they monitor the whole interaction, and it was a password pair. Luckily, since COVID, that has gone away. I'm not sure whether it's a permanent change or it's temporarily suspended. Now, instead of that one, to assess your communication skills, there is something called occupational English test. So that's the third step. So step 1, step 2 CK, then occupational English test. And after occupational English test, you have to go through ECFMG pathways. And that's also a new addition since COVID time. There are 6 pathways, and everything is written in detail on the ECFMG website. So, but looking at the pathways, what I could figure out was the pathway 1 is what we all opt for. So pathway 1 is for all the graduates. So the doctors who graduated from their med school outside US. So that would be the main ECFMG pathway 1 would be the main one to go to. And there is another exam, step 3. So USMLE has so many steps. So step 3, you don't need, so after these pathways, actually ECFMG would be able to certify you. So once you get the ECFMG certification, you will be able to apply to the residency programs here. You do not need step 3, but if you did step 3 and scored good, if you have good scores in there, that's actually good. But if you have bad scores, that may affect you adversely. So, but one another reason to take step 3 before the matching is to get a visa. So if you want H-1B visa, that's the desired visa for IMGs here. If you want that, you have to take step 3, but you don't need step 3 to apply to residency programs. Okay, so once you are done with step 1, step 2 CK, OET, you get ECFMG certified, and then ECFMG will give you a token. And then there is another website that you have to go to. Let me tell you, the whole process seems so complicated, and it is actually complicated, different websites and stuff that you have to register. But then once you familiarize yourself with these websites, it's okay. So the next website is ERAS. It is Electronic Residency Application Services. So you have this ERAS opens around June 7th, early June, and you start the process. So once you get the ECFMG token, you can get into ERAS, and ERAS has a list of all the programs, whichever specialty you want to go into. The program list is there, and you can start applying from early September, and the programs review your application mid-September or so, and then they will start calling you for interviews around October. The interview season is October through, I would say, early February. Then in the meantime, there is another website, National Residency Matching Program, NRMP. You have to register to that website. So after interviews, you rank the programs. You rank the programs where you interviewed on the NRMP website. And then the programs will rank you too. And then the whole matching process takes place in March. Mid-March, March 13, 14, something like that is when the matching process takes place. And that day you will know whether you matched or not. And if you did not match, then there is something called supplemental offer and acceptance program, or scrambling, post-match scrambling. So they will provide you a list of programs that are still looking for candidates, and then you can apply to those programs, and that process, then they will call you for interviews and those things afterwards. So that's SOAP. And then after all these things, the residency start date is July 1st. So I would say the whole process would take 1 to 2 years. The whole application thing takes an year. USMLE preparation, if you give 3 months to each steps, it will take 6 months, 6+ months. So, yeah, so 1 to 2 years, it's a long process. Okay. And before I start talking about USMLE, the visa, so that's another big barrier for international medical graduates to come to US, visa. If you have a citizenship, or if you're a permanent resident here, of course, that's very favorable. You get more weightage than the other people who require visa. The reason is visas, of course, you need, they have to spend money on visa too, not just us. So the first visa, the B1 visa, is a visitor visa. So that's the visa that you can take to come here for exams or do clerkship, those kind of things. So that's a visitor visa. For residency program, there are 2 kinds of visas, J1 and H1B. J1 visa, ECFMG sponsors the J1 visa. It's the exchange student visitor program visa. And then H1B visa is the most desirable one, because J1 can be a big hassle. The problem with J1 is once you get into residency program, of course, you can do the residency, but after residency, you are supposed to either go back to your country for 2 years or do a J1 waiver program here in US. So there are underserved areas here where other people do not want to go. So you go there and work, and they will transition your visa to H1, and then you can go through permanent residency and citizenship afterwards. With H1, it's difficult to get. There are not many programs that offer H1. So most of the big universities and all do not sponsor H1. They will ask you to get J1 through ECFMG if they liked you. And if you got interviewed there and got accepted, then you have to get your visa through ECFMG, and that's a J1. H1, there are many community programs and all that sponsor H1. Good thing with H1 is after H1 you can transition to permanent residency and go through. You don't have to go back to your country or get a non-objection certificate or work in a remote area or anything. You can easily you can go wherever you want after residency. Yeah, but bad thing about H1 is it is sponsored by the program, and it has its own cost. So the program is essentially saying that you are a valuable candidate for them, so they are taking that cost, whereas they can easily take an American graduate or a citizen from here without that expense. So yeah, so those are the visa types. Okay, now about USMLE, the whole USMLE exams, when should you start preparing? So there are a couple of things about USMLE. USMLE is, I never gave PG exam in India, so I don't know how different it is, but I have talked to people who have taken PG, and based on that, I can say it's entirely different from our PG exam. So it's not, the preparation is entirely different. They have USMLE there are websites through which you can prepare for USMLE. Those are completely different. The question model is different. And one other question I got is it worth it? I would say, so I've been here for over, oh God, I came here 12 to 15 years ago. I went through my exams and did residency here, and I've been practicing for 10 years, and I would say it's totally worth it. The system here is great. You have so much flexibility here. Working hours are awesome. So I have never practiced in India, so I don't know how the practicing conditions there are, but I would say it's completely worth it. I know it's hard work. It's hard work in the beginning, but then it pays off. Okay, so USMLE exams again. You get more information from usmle.org. So that's the USMLE website. Nowadays, with the you guys have access to everything with the internet and the technology being so advanced. So you can access all these websites and read about. So you guys should start preparing, I would say, from your final year. There is another catch with the whole residency application. So because we are international medical graduates and we did the whole training outside of US, and US healthcare is very different from the Indian one, they really would like you to have some experience in US. So most of the students from India do is they come here for clerkship, something called clerkship. Once you graduate, you cannot do clerkship. So you have to be a med student to qualify for clerkship. Essentially, what you do is you can come after your final year, before or in between your house urgency, and do 4 weeks of elective here. Essentially, you are going to be working with the med students here in the medical school, and you'll be doing whatever they are doing too. But because it's clerkship and it's a student one, not many programs offer it. Whichever program offer, it's different for different programs. Some programs may say that you have to pass your step 1, USMLE step 1 before applying for clerkship. So if you really want to do clerkship, you will have to start preparing for USMLE step 1 in your final year for sure. So yeah, so that's but clerkship. Another thing with clerkship is it is expensive too. Some of the programs can charge up to $4,000 for the 4 weeks. Then again, you have to come here, stay here, so that's another additional cost. But if you are able to do it, I would say that's completely worth it. That's hands-on medical experience here in US, which they really value. And with those 4 weeks of experience here, you will be able to collect recommendation letters from the providers here. Again, US letter of recommendation it's valued more than outside recommendation letters. So if you know which specialty you really want to go into, look into clerkship and those for clerkship and come and do it here, and then your chance of matching would go up. So start thinking about this whole process before final year, and look into programs that offer clerkship. And the start dates may be different, maybe 1 year from then or something like that, and coordinate it accordingly. If you need step 1, USMLE step 1, you prepare for it and give it before that. Yeah. Okay, so now USMLE step 1, what is step 1? So these are all MCQs, MCQ tests. Step 1 has 280 MCQs. Believe it or not, USMLE exams are very long. So this one is total 8-hour exam. Again, all these exams are given at a prometric center. And step 1 has 7 60-minute blocks of MCQ questions, and you get 1 hour break total to eat and all. And step 2 CK is 318 MCQs, again, 8 60-minute blocks, it's total of 9 hours. Step 1 is completely non-clinical, so all the non-clinical subjects. The interesting thing about USMLE exam is the question. The questions are very long. You'll get lost reading the question. That's what happens in most of the USMLE exams. So you have to get that practice of reading long questions faster to answer. So that I would say is it's a bit different from the PG exam in India. I heard that it's more direct. The questions are more direct. Here, they'll give a scenario and then they'll ask all these questions. So the questions are pretty long. And you should be able to read all those in those 60-minute blocks. And step 2 CK is completely clinical. So all the clinical subjects come under step 2 CK. And then OET, so step 1 and step 2, you register through ECFMG, and OET has its own website, and you register for the exam through that. And the study materials are also, they have listed their study materials there, so you can go through that one. Step 1 and step 2, when I prepared for Kaplan, used to be so prominent at that time, but nowadays it's the UWorld, First Aid, those kind of books for step 1. And then step 2 CK, master the boards, UWorld again. I think UWorld is pretty good for all the 3 steps. I did talk to some of the American graduates here, and they usually use UWorld for their preparations. So, and OET, again, study materials and things are there on the website, and they will guide you. Step 3 is a 2-day exam. Day 1, 232 MCQ, again, 7-hour test. Step 3, again, day 2 is 180 MCQs, 45-minute block, 6, total 9-hour exam. And step 3, the second half of the day, you have computer simulated cases, 13 computer simulated cases for which you get 10 to 20 minutes each. Yeah, so I hope I haven't confused you guys already. It's a lot. And so another question that I got, how do I make my application strong, and what can I do during the MBBS training? I would say study well, get into the good books of your attendings, be nice to them, because if you're coming here, you need their letter of recommendation. If you don't have US letter of recommendation, you need the letter of recommendation from there. Back in those days when I came, I took a letter of recommendation from the HODs, but I was essentially writing my own. Maybe that has changed. So after I write my own, they sign, that's what, but if they can directly communicate with ECFMG, send the letter of recommendation and everything directly to ECFMG, that would be the best thing. Not sure if it is happening. Then again, USMLEs. So USMLE step 1, it's a pass or fail. That's a big change from last year. They have changed it to pass or fail. Then sorry. Step 2 CK and step 3, there are scores. So when step 1 used to be scoring, it was probably good for us, because if most of us are Indians, are good test takers, and if we get good scores, they usually screen your application based on your step 1 and step 2 scores. They used to do that before. So if you scored high, of course, you have a higher chance of getting an interview. or at least they screen based on what percentile or what score you are, and they will only look at those applications that of those applicants who got scores above a certain score. That's not there anymore. Step 2 CK, the scoring system is still there, and step 3, the scoring is there. So study well for the USMLE, don't rush it, take your own time. We all are different, and everyone needs different. Maybe one person needs 6 weeks, but the other person may need 3 to 6 months to prepare for you. Step 1, take your own time, because you don't want to fail it. If you fail, that's going to be bad for the whole application process. And step 2 CK and step 3, again, study well, be prepared, well prepared before you give the exam. And again, these are not set, there are no set dates. You can pick the date. So whenever you want to take it, you pick the date. It's not like you have to, the exam happens only twice a year or once a year or something. It happens throughout the year. Then having strong letter of recommendation would help. Again, US letter of recommendation. So that's why doing a clerkship is very important. If you can do it, or if you already graduated, then your options are to do an observership or an externship. Observership essentially means you are shadowing an independent practitioner here. You are just looking at or just observing what they are doing. You are not allowed to do anything or directly. You can interact with the patient, but then the other person will be there. But you cannot put any orders or document in the records. Externship, but good thing with observership, you don't need to pay. You don't have to pay, so it's free. But then because it's free, you have to contact multiple people to get into observership. Not many programs offer it. You have to figure out which one offers it, and you have to contact the program coordinator or program director of that program, and then ask for observership. Externship, so again, observership and externship, it's after graduation. It's not for med students, it's after graduation. Externship, again, it's a paid one because you need malpractice insurance. It's hands-on experience, but not many programs offer it. It's very difficult to get into. So I would say if you can do clerkship, that would be the easier one to get into than anything afterwards. Observership, you may be able to get into afterwards, but it's not the same as clerkship or externship. And if you have contacts here, that would be very beneficial. If you know someone, one of your senior who came here, or if you have anybody, if you know anyone who's in the system here, talk to them and they would be able to guide you properly. And also, because they are independent practitioners, they can actually take you for observership, or they have contacts here, right? Because they are already in the system, they know people here, they should be able to help you with observership or research experience, those kind of things. Or if they are with a residency program, they can easily talk to the program director, and if they can suggest your name, they will look at your application. So you need somebody to talk to the program director so that at least they look at your application. And if your application is strong, they will call you for interviews. So if you cannot get observership, externship, getting a research experience, or both observership and research experience, that would be great. You can you can volunteer for a position here, research position, and then work. But again, it takes time. If you have your own publication here, that strengthens your application. And another thing is, when you apply, I know we all are tempted to apply to the most famous university or big universities here. But the truth is, most of these universities do not look at IMG applications, and they are not very IMG friendly. So there are IMG-friendly programs. You look at those lists and you can Google those, and then you'll get a list of programs that are IMG-friendly, or the programs where your seniors went to or people you know went to. Those are most likely IMG-friendly programs. So always make a list of IMG-friendly programs and apply to all of them. That strengthens your chance of getting interviews here and getting matched. Yeah, and also be aware of the IMG-friendly specialties here. Yeah. So the whole process is long and tedious, but the match rate, actually the match rate for IMGs are not that bad. So last year, 2023 match is already over. So March is over, now it's April. So that's already over. And they actually increased the residency positions last year. And so it seems like there's 1,170 more residency positions opened in 2023. And IMGs actually, non-US citizen IMG matched 59.4% match rate last year. So I would say it's not that bad. Yeah, it's okay. Yeah, so I would say it's doable. It's just it looked difficult based on all these exams and things, but once you after the application process and all, it will get easier. If you get matched, actually it's awesome. So these are the website that I thought the links that I thought is important, and you if you guys can and I looked at all these websites before I gave this presentation, so it's very useful. And the last link is for the clerkship. I'm currently practicing in Colorado, and this is a university in Colorado, and I was going through the clerkship criteria here. And actually they need a step 1. So they have defined what is required. So every website, they have clearly documented what they expect from you, what is needed before application, etc. So yeah, so that's for one university. Okay. So that's pretty much my presentation. Please feel free to ask if you guys have any questions.
Hello, good evening, ma'am. So we had a few questions which were posted to us on the chat personally. So one of the questions was a comparison between USMLE and PLAB. So we had a session on PLAB in the morning today. So can you please entail like in terms of the difficulty of both the exams, what do you think is the more difficult exam, PLAB or USMLE?
Okay, so I saw that question. So I talked with Dr. Sridevi about the same. I have never given PLAB, so it's difficult for me to compare. But then after I talked to her, what I figured out is USMLE is far difficult than PLAB. And I thought the whole, correct me if I'm wrong, the whole process involving PLAB is you take the exam and then you are allowed to practice there, right? So that's, again, USMLE is completely different. You have to go through a training program, the whole USMLE process and the steps. It's I would say it's more difficult.
Okay, thank you, ma'am. There was also a question about racism. That means that so in the morning session, both Dr. Ashish sir and Sridevi ma'am said that the issue is not that prevalent in the UK, and they have never had to face such experiences while working in the UK. So have you had any experiences, ma'am, while working in the US with racism?
So I would say no. US is very open. Because this is a country of immigrants, right? So there are people from every country here. and every country, there are good and bad people. So I can't say that there won't be any racial discrimination, but I can say for sure in the whole process of residency, the interviews and things, you won't see racism anywhere. There may be small corners of US where there can be, but my experience, I would say during my only one experience, which I thought was a bit racist, was when I started my internship here. So residency, the 3-year residency, the first year is called the internship. And and you are from outside and you are an intern, you don't know the system well. And an alcoholic guy, I was talking to an alcoholic guy, he was completely out of it anyway. So he, all of a sudden, he's like, oh, I want to talk to a US, an American doctor. And then my attending comes in and he actually covered me pretty good there. He's like, okay, you got the best doctor here. If you really don't want her, then okay, you got me, deal with me. So the attendings, the doctors here are very good. I have never experienced any racial discrimination from my colleagues or anyone or any doctors or nurses or any of the healthcare workers. I would say no, and not many patients even ask you where you're from or anything. They treat you similar to the American graduates. And actually, Indian doctors are highly regarded here. Some of them really prefer Indian doctors because they think we are very thorough compared to American ones. So I would say, don't. US is very open. It's a free country. I don't think there's much racism here. I know you guys have been watching all those videos and all about all those racial events and things here, but those are isolated events. They are trying to accommodate. In the past, they have done something like those slavery and things, and they are trying to come over all of those and make things right. But the discrimination, there is not much, I would say.
Okay, thank you, ma'am. I just got another question that is regarding the research options which were associated with USMLE. I mean, are there any good, is there any scope for research associated with USMLE in the US? I mean, what are the options in the pay or prospects of research, ma'am, in the US?
So let me clarify. So is it research experience before USMLE? Is that the question?
No, like can we take up research as a career option along with USMLE? Like, are there any research fellowships or something associated with USMLE? Is what the question was, ma'am.
So you can take research. So that's another thing with all these residencies. So after USMLE, right? You're talking about residency and research. Is that it?
Yes, ma'am. Yeah, yes, ma'am.
Okay. So all the years of training that I put there, after that, so if you want to go into research, most of these programs have 1-year research afterwards. You can opt for research. Yeah. So that I didn't include it in the duration for residency, but that's how. If you are into research, you can do an extra year training in research after graduate. Yeah, after year 3-year or after your graduation. Or I would say before graduation. So that can be included in the program. And
okay,
because research is so much valued in US, some of the programs say research is a must. So even some of the fellowships they give, if, for example, if nephrology here is 2-year, and then after that you can take 1-year research. So they would encourage you to go into research, but it's completely optional. If you like it, you can go into it.
Okay, thank you, ma'am. There's another question. So the question is, how long does it take for a person who graduate from India to become accustomed to the US system of medicine? And how different was it for you personally from house surgency at GMC Thrissur transitioning to the US, ma'am?
Okay. Can you repeat that question?
Ma'am, the question is, how long does it take for somebody from India to get accustomed to the US system of medicine? And how different was it for you personally when compared to doing house surgency at our GMC Thrissur Medical College, ma'am?
Okay. Okay. So my experience. So I came here 10, 15 years ago. At that time, the reason why I came was I got married to a person who's working here, and I wasn't planning for this. So it was entirely an unplanned one. So I did house agency there, and then I worked I did that compulsory public health service for 6 months, and then I came here, took my USMLEs. For me, looking back, I would say if there was someone to give a talk like this before I came here, it would have been very beneficial. I didn't think much about USMLE, and the whole impression I got from at that time from people with whom I talked was, if you get good scores, of course you will match, you will get into residency. That's the whole impression I got. And when I gave my exam, it was in percentiles. So the scores are reported as percentiles. So 99 percentile is the highest. So they are like, okay, so if you get 99 in step 1, step 2, CK, and then past steps, CS, you will automatically get interviews. After I figured it out the hard way, after I came here, that is not the case. It's not just the scores that they look at everything, and they prefer you to have some experience here. And then visa is a big factor. If you need visa, it's going to be difficult, especially H1. So I learned it the hard way after coming here. So I did observership here. I did some research too, and I did in electrophysiology, and I didn't have the publication before application, but I did prepare for publication, and then the observership, 4 weeks of observership, and afterwards I applied, and again, I don't think I was not many people told me that you have to search for IMG friendly programs. So I applied to all those universities when I applied. I'm like, okay, they don't, later I realized they don't even look at your application. So if I would say if somebody gave me this talk before I came to US, it would have been very beneficial. But then I applied and got into, luckily, I applied to IMG friendly programs too, and then got into a program in Wisconsin. And I went for all the interviews and luckily mastered that place. I would say I was lucky to go through the residency program there. The whole experience was awesome. I really loved the med school experience in Kerala, Thrissur, but residency experience was very different. You work closely with, and the residency numbers are so some of the programs have like 50, 60 residents a year. Some programs have 8 or 10 residents a year. So very closely knit. And the program director was very nice. All were very supportive. And within 6 months, I would say I got accustomed to the system here. Once you start doing the clinical rotations here, you will get into the system. It's not I won't say it's very difficult to get accustomed to the system. It's different from India, but you will learn it faster. Um, yeah. And once you get into, actually, IMGs do way better than most other AMGs because you're very hardworking. And the main thing about US is they really appreciate the hard work and sincerity. So if you're good, if you're doing it good and sincere, you will benefit from it. They will really appreciate you. There is no discrimination there. Once you get into the residency program, AMG, IMG, all are treated alike. Hope I answered that question.
Okay, thank you, ma'am. There was another question that's asked about, which is regarding the language barrier. So, is preparing for the single OET exam, does that make you proficient enough to practice in the US language-wise? As in, does it help you deal with patients? How much time does it take for the accent and all that language to become perfect while practicing now?
So okay. So one advantage you guys have is the internet, right? Now the world is so small with the technology being so advanced. You guys are watching all the English movies, watching all the stuff from here, the YouTube channels and all. I don't think you guys will have problems with the accent here. To understand the accent and for them to understand our accent, I would say when you guys come here, talk slowly. That would help them. But once you start working here and start interacting with them, it gets easier. There are some pronunciations that are different, which you will realize right away when you come here and start talking. There are some, I would say there are some words which I still pronounce wrong because the pronunciation is very different, like UK English different, US English is different. But at the same time, people here itself pronounce one word in two ways. And some of the medications that we use, the pronunciation is different, but that you will learn right away. I would say in 1 to 2 months, you would be able to catch that. The OET exam. So OET exam has the reading, they assess your reading, listening, speaking, and writing skills. They essentially want to make sure that you understand, and that's a medical test. So it's medical English. It's not just ordinary English. They are trying to make sure that you understand what the patient is telling, and you have the ability to respond back properly. So I think that screening test is very good. But then improving your accent and everything, you have to come here and work with the people here. So talk to the US people and then you will get more used to that language.
Okay, thank you, ma'am. There was another question and it's about the scholarships. So what are scholarships can a student from India avail while trying to write USMLE or to get into the residency program, because the cost is a concern for most students, right? So are there any scholarships which are out there which are accessible to Indian students now?
So the truth is, the question is about scholarship for residency or the whole process of coming here?
For both, ma'am, because generally, what are the scholarships that are associated with the USMLE and residency?
Okay, so there are no scholarships for taking USMLE test, right? You have to take that cost. But let me tell you something, it will seem expensive. It seems expensive. So if you're doing clerkship, $4,000, almost give or take 4,000. And then the USMLE exams, the whole steps, I think it would come around 4,000. And then the residency interview, if you're coming here, you have to stay here and travel. The residency application is not too much expensive, but still depending on how many programs you're applying to. So that I would say another 4,000. 4,000 or more. So altogether, the cost will come to around $15,000. It is expensive, but I don't think it's what if it's there are no scholarships for that because you're trying to get into a system, right? So nobody's going to give a scholarship for that. And for residency, you don't need a scholarship. You get money from them. They pay you for residency, for doing residency. And that money is good enough for 1 or 2% to live in this country. So it's not that money. I would say 60 to 70,000 is what an average American make here with other professions or the starting job. They get paid around 70 or 80,000, and you're getting paid around 65,000 a year for the residency. It is, when you look back, of course, it's small, but you can easily live with that. And let me tell you something, the whole USMLE cost, it's totally worth it. You will make all those money in no time. So don't worry about that money. If you have that much money to spare, and if you're confident, if you are going to work hard, you will get into the system. And after residency, you are going to make that money back. So don't worry about that at all. I don't think you would lose that. Yeah, but there are no scholarships for preparing for USMLE. But if you can spare that money, it would be totally worth it. And actually, once you graduate from residency, if you want to go for fellowship, go for it. And then afterwards, you can practice. Fellowship is, again, I think you get around $80,000 to $90,000 or something. Again, pay is relatively low when you compare to a physician, a practicing physician, but you are learning at the same time too. So one thing you have to think about is the med students here. So the 4-year undergrad and 4-year med school, every year they are spending $60,000 to $80,000. I would say give or take 60 to 80,000 for every year from undergrad 4, then med school. They have a huge debt when they get out of med school. We are lucky not to have that much debt. So when you compare yourself with an American medical graduate who went through residency and us, if we went through residency and start practicing, the physician who came through American system has around 400,000 or more debt. And we won't have any debts because we did residency, we were getting paid the whole time. So it's yeah, so sometimes I think that it's not a just thing for the American graduates, because they come out with so much debt. They go to all these universities here, and when they practice, they have these huge debts. And I look at myself and I'm like, okay, I don't have any because I didn't go through the medical system here. I went to med school in Thrissur, and government took most of our education. So we are really lucky to go through the system there. So don't worry about money, no scholarship for taking USMLE, but if you get through it, it's completely worth it. And the truth is, US doctors are very well paid. The US physician salary is way a lot than most other countries.
Okay, thank you, ma'am. I think that was the last question in the chat box. So if you have anything to add, I think.
So I have given you guys my email ID. So if anybody want to touch base with me about if you have any question that pop up in your mind later, just send me an email and I'll reply as soon as possible. I would like to help you guys. If you want to come here, think about it. I don't know what the system and how the medical PG there is and how the healthcare system there is. you know it better. And if you think that you want to get out and you want to explore your other options, if you want to come to US, and if you have any question regarding the application process or anything, just you can contact me too for that.
And we just had one more question in the chat box. That is, for a person interested in internal medicine, what all are the further career options available in the US, specifically for internal medicine?
Okay, so internal medicine. I think I showed the slide. So internal medicine, there is this primary care version and categorical. Categorical is more inpatient-based medicine, but that doesn't mean after doing categorical you cannot go to primary care. So after 3 years of internal medicine, you can either go into primary care medicine, which is purely office-based. So you will have your set patients and you can practice. There is something called in primary care itself, there is something called concierge medicine, in which the patients will continuously pay the doctor money so that they can contact you whenever they want. But they'll be giving you money every month, which is very popular nowadays. So you won't find many primary care physicians doing the other stuff. So that's one. So it's completely office job. There used to be the traditional medicine in which the primary care physicians would come to the hospital and treat the admitted patients, but that is going away. That's becoming very remote. So for internal medicine, there is a primary and then an inpatient medicine. So what I'm doing as a hospitalist medicine, which is an inpatient part, I work in the hospital. I work fixed shifts. I can mostly I work 15 to 16 days a month. The rest of the days I'm off and at home or doing whatever I want. It's a model that people, if you like acute care only, you can choose for that one. It's completely inpatient. And some of the remote hospitals, you handle the inpatient, ICU patients and everything. Major cities, there are critical care physicians to handle that ICU. So you do the floor admission. So essentially, a hospital in US, there is an emergency department. Emergency department is staffed by emergency medicine doctor. And then the floor patients. So if the patient is sick enough, they will call the hospitalist and you admit and take care of the patient. And then in places where the ICU is closed, that means ICU is handled by ICU physician. If your patient gets way sicker, then you transfer. If you have to transfer the patient to ICU, there are set criteria for that. Then you hand over the care to the ICU doctor, or you do it with the ICU doctor. Some places you do it yourself. So that's acute care part of internal medicine. After 3-year internal medicine, if you like one subspecialty, you can go for fellowship. So that's the best thing about residency program here. Once you graduate from internal medicine, from any residency program, you are considered the same as an American graduate, except if you don't have a visa. So that's a difference. But if you have a visa, for example, when I graduated, I already had my permanent residency here. So if I apply for any fellowship, I would be considered the same, equal to an American graduate, because they don't have to sponsor visa or anything. So after internal medicine, you can go into fellowship. So the same subspecialties, right? Endocrinology, rheumatology, cardiology, GI, you name it, nephrology, all those specialties. And each are different. Like rheumatology is 2 years, nephro is 2, cardiology is 3 for general cardiology. And if you want to go into interventional cardiology, that's extra 1 year. Or if you want to go to EP, electrophysiology, that's another 1 year. So it become a 4-year program. Then GI, then hematology is a part of internal medicine here. So that's 3 years. So it's variable based on which one you want to do. Yeah, so that's another option. Again, after internal medicine, you can go into research. Research is another thing. then some of the internal medicine physicians or any other specialty physicians go into or get into this medical directorship with insurance companies or pharmaceutical companies. If you are not interested in practicing, you can do those kind of jobs too. So it's very flexible here after residency. You can do clinical or non-clinical, whichever you want, you can go that way. If you want to focus more on research, you can go that way. So there are so many options here, which make it very attractive.
Okay, thank you, ma'am. So that brings us to the end of the Q&A session. So that brings us to the end of the session, basically, ma'am. So we're going to conclude. So on behalf of the college union, I would like to extend my heartfelt gratitude to Dr. Smita ma'am for explaining the long and complex process of USMLE in simple terms and for sharing her experiences as a practicing doctor in the United States. We understand, ma'am, that there were a lot of issues involved with the different time zones and your hectic schedule. And we're extremely grateful to you for finding this time to enlighten us. And I'm sure that this session has helped us clear our doubts, and we now have a very clear idea about USMLE and the residency program in the US. So once again, thank you, ma'am. Thank you so much for hosting this session.
Thank you so much for having me. The pleasure is all mine.
Okay. Thank you. Thank you so much, ma'am. Thank you.
Thank you.